Hey, Alpha Nurses, I'm Licensure from alphanurseguy.com. This is musculoskeletal disorder questions. Without delay, let's get started.
The emergency department nurse receives a call about a patient with a traumatic finger amputation. What instructions will the nurse provide to the patient's wife? Select all that apply. 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 3. Place the bag directly on ice. 4. Elevate the affected extremity above the patient's heart. 5. Examine the amputation site and apply direct pressure with layers of dry gauze. 6. After performing these steps, call 911 and check the patient for breathing. The correct answers are 1. Wrap the completely severed finger in dry sterile gauze or a clean cloth. 2. Put the finger in a watertight, sealed plastic bag. 4. Elevate the affected extremity above the patient's heart. And 5. Examine the amputation site and apply direct pressure with layers of dry gauze. Rationale. For a person who has a traumatic amputation in the community, first call 911 and then assess the patient for airway or breathing problems. Examine the amputation site and apply direct pressure with layers of dry gauze or cloth. Elevate the extremity above the patient's heart to decrease the bleeding. Do not remove the dressing to prevent dislodging the clot. Wrap the completely severed finger in dry sterile gauze or a clean cloth. Put the finger in a watertight, sealed plastic bag. Place the bag in ice water, never directly on ice, with 1 part ice and 3 parts water. Avoid contact between the finger and the water to prevent tissue damage. Do not remove any semi-detached parts of the digit. Be sure that the part goes with the patient to the hospital. The nurse is assisting with a student assessment screening of 6th graders at the local grade school. A student presents with a back and spine, as in the following illustration. What is the nurse's best interpretation of this finding? 1. Dupuytren contracture. 2. Cole's fracture. 3. Scoliosis. 4. Lordosis. The correct answer is 3. Scoliosis. Rationale. Scoliosis occurs when the vertebrae rotate and begin to compress. The spinal column moves into a lateral curve. On assessment, findings include asymmetry of hip and shoulder height with prominent thoracic ribs and scapula on one side. Dupuytren contracture is a hand deformity with slow progressive thickening of the palmar fascia leading to flexion contracture of the 4th and 5th fingers. Cole's fracture occurs in the distal radius. Lordosis is a loss of lumbar curvature, sometimes called flat back, which may also be present with scoliosis. A patient has a fractured femur, which finding would the nurse instruct the assistive personnel to report immediately? 1. The patient reports pain. 2. The patient appears confused. 3. The patient's blood pressure is 136/88. 4. The patient voided using the bedpan. The correct answer is 2. The patient appears confused. Rationale. Fat embolism syndrome is a serious complication that often results from fractures of long bones. Its earliest manifestation is altered mental status caused by a low arterial oxygen level. The nurse would want to know about and treat the pain, but it is not life-threatening. The nurse would also want to know about the blood pressure in the patient's voiding. However, this information is not urgent to report. The nurse is providing care for a patient with a connective tissue disorder exacerbation for whom the healthcare provider has prescribed an IV dose of methylprednisolone 20 milligrams in 50 milliliters normal saline to be infused over 30 minutes. At what rate will the nurse set the IV infusion pump to administer this drug correctly? The correct answer is 100 milliliters per hour. Rationale. The formula is volume in ml multiplied by 60 divided by time in minutes. You multiply 50 times 60 and divide by 30 minutes. The end result is 100. The nurse is caring for a patient who had a dual energy X-ray absorptiometry scan and is now prescribed calcium with vitamin D twice a day. The patient asked the nurse the purpose of this drug. What is the nurse's best response? Select all that apply. 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 2. When your vitamin D level is high, your bones release calcium to keep your blood calcium level in the normal range. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. 4. When blood calcium is normal, long bones are formed, increasing a person's height. 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. 6. You can also get extra vitamin D by increasing your intake of beef and pork sources. The correct answers are 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. And 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. Rationale: vitamin D and its metabolites are produced in the body and transported in the blood to promote the absorption of calcium and phosphorus from the small intestine. There is a relationship between calcium and phosphorus, so that if a patient's phosphorus level is higher than normal, the calcium level will drop, and vice versa. A decrease in the body's vitamin D level can result in osteomalacia, softening of bone, in an adult. When serum calcium levels are lowered, parathyroid hormone secretion increases and stimulates bone to promote osteoclastic activity and release calcium to the blood. PTH reduces the renal excretion of calcium and facilitates its absorption from the intestine. Sources of vitamin D include sunlight, fatty fish, and vitamin D-enriched foods. When receiving discharge instructions, a patient with osteoporosis makes all of these statements. Which statement indicates to the nurse that the patient needs additional teaching? 1. I take my ibuprofen every morning as soon as I get up. 2. My daughter removed all of the throw rugs in my home. 3. My husband helps me every afternoon with range of motion exercises. 4. I rest in my reclining chair every day for at least an hour. The correct answer is 1. I take my ibuprofen every morning as soon as I get up. Rationale: ibuprofen can cause abdominal discomfort or pain and ulceration of the gastrointestinal tract. In such cases, it should be taken with meals or milk. Removal of throw rugs helps prevent falls. Range of motion exercises and rest are important strategies for coping with osteoporosis. The nurse is receiving a patient with peripheral vascular disease from the post-anesthesia care unit after a SIME amputation of the right lower extremity. At which level on this diagram would the nurse expect to find the amputation? 1A, 2B, 3C, 4D. The correct answer is 3C. Rationale: when a patient has a SIME amputation, most of the foot is removed but the ankle remains. Advantages of the surgery over below the knee include that the patient can still be weight-bearing and that there is less pain. The nurse is preparing a discussion of musculoskeletal health maintenance for a group of older adults. Which key points would the nurse be sure to include? Select all that apply. 1. Be aware of and consume foods rich in calcium and vitamin D. 2. Wear hats and long sleeves to avoid sun exposure at all times. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. 6. Weight-bearing activities decrease the risk for osteoporosis. The correct answers are 1. Be aware of and consume foods rich in calcium and vitamin D. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. And 6. Weight-bearing activities decrease the risk for osteoporosis. Rationale: many health problems of the musculoskeletal system can be prevented through health promotion strategies and avoidance of risky lifestyle behaviors. Weight-bearing activities, such as walking, can reduce risk factors for osteoporosis and maintain muscle strength. Young men are at the greatest risk for trauma related to motor vehicle crashes. Older adults are at the greatest risk for falls that result in fractures and soft tissue injury. High-impact sports, such as excessive jogging or running, can cause musculoskeletal injury to soft tissues and bone. Tobacco use slows the healing of musculoskeletal injuries. Excessive alcohol intake can decrease vitamins and nutrients a person needs for bone and muscle tissue growth. Hats and long sleeves are recommended to prevent sunburn, but the nurse would recommend 20 minutes of sun exposure several times a week for vitamin D, which contributes to bone health. The nurse is teaching an older patient about risks for fractures and osteoporosis. Which diagnostic test should the nurse teach about when the goal is to establish the patient's bone strength and determine if osteoporosis is present? 1. Computed tomography scan. 2. Magnetic resonance imaging scan. 3. Dual energy X-ray absorptiometry scan. 4. Joint X-rays. The correct answer: 3. Dual energy X-ray absorptiometry scan. Rationale: testing bone density is the only way to know for sure whether or not a patient has osteoporosis. A diagnostic test commonly prescribed by healthcare providers is dual energy X-ray absorptiometry scan. This type of scan focuses on two main areas, the hip and the spine. The forearm can be tested, however, if the hip or spine cannot be tested. The other tests may be prescribed, but are not as commonly used to test bone strength. The nurse is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to the assistive personnel? 1. Identifying environmental factors that increase the risk for falls. 2. Monitoring gait, balance, and fatigue level with ambulation. 3. Collaborating with the physical therapist to provide the patient with a walker. 4. Assisting the patient with ambulation to the bathroom and in the halls. The correct answer is 4. Assisting the patient with ambulation to the bathroom and in the halls. Rationale. Assisting with activities of daily living, including assisting with ambulation to the bathroom and in the halls, is within the scope of the AP's practice. The other 3 interventions require additional educational preparation and are within the scope of practice of licensed nurses. The nurse is preparing a patient for magnetic resonance imaging. Which action can the nurse delegate to the experienced assistive personnel? 1. Teach the patient what to expect during the test. 2. Instruct the patient to remove metal objects, including zippers. 3. Witness that the patient has signed the consent form. 4. Check and record pre-procedure vital signs. The correct answer is 4. Check and record pre-procedure vital signs. Rationale. The AP scope of practice includes checking and recording patient vital signs. Teaching and instructing, as well as witnessing consent forms, is appropriate to the professional nurse's scope of practice. The AP could remind the patient about the removal of metal objects after the patient receives that instruction. The nurse is preparing to teach a patient with a new diagnosis of osteoporosis about strategies to prevent falls. Which teaching points should the nurse be sure to include? Select all that apply. 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. 4. Expect a few bumps and bruises when you go home. 5. Rest when you are tired. 6. Avoid consuming 3 or more alcoholic drinks per day. The correct answers are 1. Wear a hip protector when ambulating. 2. Remove throw rugs and other obstacles at home. 3. Exercise to help build your strength. And 5. Rest when you are tired. Rationale. The purpose of this teaching is to help the patient prevent falls. The hip protector can prevent hip fractures if the patient falls. Throw rugs and obstacles in the home increase the risk of falls. Patients who are tired are also more likely to fall. Exercise helps to strengthen muscles and improve coordination. Women should not consume more than 1 drink per day, and men should not consume more than 2 drinks per day. The nurse is mentoring a student nurse who is caring for a patient with carpal tunnel syndrome of the right hand with a neurovascular check ordered every 2 hours. For which action by the student nurse must the nurse intervene? 1. Student nurse checks the patient's radial pulse every 2 hours. 2. Student nurse checks for sensation in the patient's right hand. 3. Student nurse assesses color, temperature, and pain in right wrist and hand. 4. Student nurse instructs the patient to avoid movement because of the pain. The correct answer is 4. Student nurse instructs the patient to avoid movement because of the pain. Rationale. Performing complete neurovascular assessment includes palpation of pulses in the extremities below the level of injury and assessment of sensation, movement, color, temperature, and pain in the injured part. If pulses are not palpable, use of a Doppler helps find pulses in the extremities. After surgery, the patient should be given pain medication and encouraged to move the fingers frequently. Some hand movements, such as lifting heavy objects, may be restricted for 4 to 6 weeks after surgery. The nurse's assessment reveals all of these data when a patient with Paget disease is admitted to the acute care unit. Which findings should the nurse notify the healthcare provider about first? 1. There is a bowing of both legs, and the knees are asymmetrical. 2. The base of the skull is invaginated platybasia. 3. The patient is only 5 feet tall and weighs 120 pounds. 4. The skull is soft, thick, and larger than normal. The correct answer is 2. The base of the skull is invaginated platybasia. Rationale. Platybasia, basilar skull invagination, causes brainstem manifestations that threaten life. Patients with Paget disease are usually short and often have bowing of the long bones that results in asymmetrical knees or elbow deformities. The skull is typically soft, thick, and enlarged. The emergency department nurse should question which healthcare provider prescription when providing care for an older adult with a fracture of the left ulna. 1. Get x-rays of the left forearm. 2. Give him a Paradine IM for pain. 3. Monitor vital signs every hour. 4. Elevate left arm on pillows. The correct answer is 2. Give meperidine IM for pain. Meperidine should not be used because of its toxic metabolites that can cause seizures and other adverse drug events, especially in the older adult population. X-rays are used to confirm the diagnosis. Vital signs and elevation are common actions for a patient in the emergency department, and elevation can decrease the swelling in the affected extremity. The charge nurse observes an LPN/LVN assigned to provide all of these interventions for a patient with Paget disease. Which action requires that the charge nurse intervene? 1. Administering 600 milligrams of ibuprofen to the patient. 2. Encouraging the patient to perform exercises recommended by a physical therapist. 3. Applying ice and gentle massage to the patient's lower extremities. 4. Reminding the patient to drink milk and eat cottage cheese. The correct answer is 3. Applying ice and gentle massage to the patient's lower extremities. Rationale. Applying heat, not ice, is the appropriate measure to help reduce the patient's pain. Ibuprofen is useful to manage mild to moderate pain. Exercise prescribed by a physical therapist would be non-impact in nature and provide strengthening for the patient. A diet rich in calcium promotes bone health. The nurse is caring for a postoperative patient with a hip replacement. Which patient care actions can be delegated to the experienced assistive personnel? Select all that apply. 1. Inspect heels and other bony prominences every 8 hours. 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. 4. Assess the patient's calf regions for redness and swelling. 5. Check vital signs and oxygen saturation via pulse oximetry. 6. Assess for pain and administer pain medication. The correct answers are 2. Turn and reposition the patient every 2 hours. 3. Ensure that the patient's heels are elevated off the bed. And 5. Check vital signs and oxygen saturation via pulse oximetry. Rationale. The AP scope of practice includes repositioning patients and checking vital signs, and an experienced AP would know how to check pulse oximetry and elevate the patient's heels off the bed. Assessing and inspecting patients is more appropriate to the educational level of the professional nurse. The charge nurse is making assignments for the day shift. Which patient should be assigned to the nurse who was floated from the post-anesthesia care unit for the day? 1. A 35-year-old patient with osteomyelitis who needs teaching before hyperbaric oxygen therapy. 2. A 62-year-old patient with osteomalacia who is being discharged to a long-term care facility. 3. A 68-year-old patient with osteoporosis given a new orthotic device whose knowledge of its use must be assessed. 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. The correct answer is 4. A 72-year-old patient with Paget disease who has just returned from surgery for total knee replacement. Rationale. The post-anesthesia care unit nurse is very familiar with the assessment skills necessary to monitor a patient who just underwent surgery. For the other patients, nurse is familiar with musculoskeletal system. Related nursing care are needed to provide teaching and assessment and prepare a report to the long-term care facility. A patient who underwent a right above the knee amputation 4 days ago also has a diagnosis of depression. Which prescription would the nurse clarify with the healthcare provider? 1. Give fluoxetine 40 milligrams once a day. 2. Administer acetaminophen with codeine 1 or 2 tablets every 4 hours as needed. 3. Assist the patient to the bedside chair every shift. 4. Reinforce the dressing to the right residual limb as needed. The correct answer is 1. Give fluoxetine 40 milligrams once a day. Rationale. Doses of fluoxetine, a drug used to treat depression, that are greater than 20 milligrams should be given in 2 divided doses, not once a day. The other 3 prescriptions are appropriate for a patient who underwent amputation 4 days earlier. The nurse delegates the measurement of vital signs to an experienced assistive personnel. Osteomyelitis has been diagnosed in a patient. Which vital sign value would the nurse instruct the AP to report immediately for this patient? 1. Temperature of 101 degrees Fahrenheit. 2. Blood pressure of 136/80. 3. Heart rate of 96 beats per minute. 4. Respiratory rate of 24 breaths per minute. The correct answer is 1. Temperature of 101 degrees Fahrenheit. Rationale. An elevated temperature indicates infection and inflammation. This patient needs IV antibiotic therapy. The other vital sign values are normal or high normal. During the assessment of a patient with fractures of the medial ulna and radius, the nurse finds all of these data. Which assessment findings should the nurse report to the healthcare provider immediately? 1. The patient reports pressure and pain. 2. The cast is in place and is dry and intact. 3. The skin is pink and warm to the touch. 4. The patient can move all the fingers and the thumb. The correct answer is 1. The patient reports pressure and pain. Rationale. Pressure and pain may be caused by increased compartment pressure and can indicate the serious complication of acute compartment syndrome. This situation is urgent. If it is not treated, cyanosis, tingling, numbness, paresis, and severe pain can occur. The other findings are normal and should be documented in the patient's chart. The nurse is working with an assistive personnel to provide care for 6 patients. At the beginning of the shift, the nurse carefully tells the AP what patient interventions and tasks he or she is expected to perform. Which 4 C's guide the nurse's communication with the AP? Select all that apply. 1. Clear. 2. Comprehensive. 3. Concise. 4. Credible. 5. Correct. 6. Complete. The correct answers are 1. Clear, 3. Concise, 5. Correct, and 6. Complete. Rationale. Clear, concise, correct, and complete are the 4 C's of communication. Implementing the 4 C's of communication helps the nurse ensure that the AP understands what is being said, that the AP does not confuse the nurse's directions, that the directions comply with policies, procedures, job descriptions, and the law, and that the AP has all the information necessary to complete the tasks assigned. During morning care, a patient with a below-the-knee amputation asks the assistive personnel about prostheses. How will the nurse instruct the AP to respond? 1. You should get a prosthesis so that you can walk again. 2. Wait and ask your healthcare provider that question the next time he comes in. 3. It's too soon to be worrying about getting a prosthesis. 4. I'll ask the nurse to come in and discuss this with you. The correct answer is 4. I'll ask the nurse to come in and discuss this with you. Rationale. The patient is indicating an interest in learning about prostheses. The experienced nurse can initiate discussion and begin educating the patient. Certainly, the HCP can also discuss prostheses with the patient, but the patient's wish to learn should receive a quick response. The nurse can then notify the HCP about the patient's request. The nurse is caring for a patient with carpal tunnel syndrome who has been admitted for surgery. Which intervention should be delegated to the assistive personnel? 1. Initiating placement of a splint for immobilization during the day. 2. Assessing the patient's wrist and hand for discoloration and brittle nails. 3. Assisting the patient with daily self-care measures, such as bathing and eating. 4. Testing the patient for painful tingling in the 5 digits of the hand. The correct answer is 3. Assisting the patient with daily self-care measures, such as bathing and eating. Rationale. Helping with activities of daily living is within the scope of practice of APs. Placing a splint for the first time is appropriate to the scope of practice of physical therapists. Assessing and testing for paresthesia are not within the scope of practice of APs and are appropriate for professional nurses. A patient with a right above the knee amputation asks the nurse why he has phantom limb pain. What is the nurse's best response? 1. Phantom limb pain is not explained or predicted by any one theory. 2. Phantom limb pain occurs because your body thinks your leg is still present. 3. Phantom limb pain will not interfere with your activities of daily living. 4. Phantom limb pain is not real pain but is remembered pain. The correct answer is 1. Phantom limb pain is not explained or predicted by any one theory. Rationale. 3 theories are being researched with regard to phantom limb pain. The peripheral nervous system theory suggests that sensations remain as a result of the severing of peripheral nerves during the amputation. The central nervous system theory states that phantom limb pain results from a loss of inhibitory signals that were generated through afferent impulses from the amputated limb. The psychological theory helps predict and explain phantom limb pain because stress, anxiety, and depression often trigger or worsen a pain episode. The nurse observes the assistive personnel performing all of these interventions for a patient with carpal tunnel syndrome, which action requires that the nurse intervene immediately. 1. Arranging the patient's lunch tray and cutting his meat. 2. Providing warm water and assisting the patient with his bath. 3. Replacing the patient's splint in hyperextension position. 4. Reminding the patient not to lift very heavy objects. The correct answer is 3. Replacing the patient's splint in hyperextension position. Rationale. When a patient with CTS has a splint to immobilize the wrist is placed either in the neutral position or in slight extension, not hyperextension. The other interventions are correct and are within the scope of practice of an AP. APs may remind patients about elements of their care plans that have already been taught, such as avoiding heavy lifting. The charge nurse is assigning the nursing care of a patient who had a left below the knee amputation one day ago to an experienced nurse who will function under the lead nurse's supervision. What will the lead nurse tell the experienced nurse is a major focus of the patient's care today? 1. To attain pain control over phantom pain. 2. To monitor for signs of sufficient tissue perfusion. 3. To assist a patient to ambulate as soon as possible. 4. To elevate the residual limb when the patient is supine. The correct answer is 2. To monitor for signs of sufficient tissue perfusion. Rationale. Monitoring for sufficient tissue perfusion is a priority at this time. Phantom pain is a concern, but is more common in patients with above-the-knee amputations. Early ambulation is a goal, but at this time, the patient is more likely to be engaged in muscle-strengthening exercises. Elevating the residual limb on a pillow is controversial because it may promote knee flexion contracture. A patient is scheduled for endoscopic carpal tunnel release surgery in the morning. What would the nurse be sure to teach the patient? 1. Pain and numbness are expected to be experienced for several days to weeks. 2. Immediately after surgery, the patient will no longer need assistance. 3. After surgery, the dressing will be large and there will be lots of drainage. 4. The patient's pain and paresthesia will no longer be present. The correct answer is 1. Pain and numbness are expected to be experienced for several days to weeks. Rationale. Postoperative pain and numbness occur for a longer period of time with endoscopic carpal tunnel release than with an open procedure. Patients often need assistance post-operatively, even after they are discharged. The dressing from the endoscopic procedure is usually very small, and there should not be a lot of drainage. The nurse is supervising a newly graduated nurse caring for a patient with a fracture of the right ankle who is at risk for complications of immobility. For which action should the supervising nurse intervene? 1. Encouraging the patient to go from a lying to a standing position. 2. Administering pain medication before the patient begins exercises. 3. Explaining to the patient and family the purpose of the exercise program. 4. Reminding the patient about the correct use of crutches. The correct answer is 1. Encouraging the patient to go from a lying to a standing position. Rationale. Moving directly from a lying to a standing position does not allow the patient to establish balance. The supervising nurse should instruct the newly graduated nurse about moving the patient from a lying position first, then to a sitting position, and finally to a standing position, which will allow the patient to establish balance before standing. Administering pain medication before the patient begins exercising decreases pain with exercise. Explanations about the purpose of the exercise program and proper use of crutches are appropriate interventions for this patient. The charge nurse assigns the nursing care of a patient who has just returned from open carpal tunnel release surgery to an experienced LPN/LVN. Which instructions would the charge nurse provide for the LPN/LVN? Select all that apply. 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. 4. The patient will no longer need pain medication. 5. Check the neurovascular status of the fingers every hour. 6. Instruct the patient to perform range of motion on the affected wrist. The correct answers are 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. And 5. Check the neurovascular status of the fingers every hour. Rationale. Post-operatively, patients undergoing open carpal tunnel release surgery experience pain and numbness, and their discomfort may last for weeks to months. Hand movements may be restricted for 4 to 6 weeks after surgery. All of the other directions are appropriate for the postoperative care of this patient. It is important to monitor for drainage, tightness, and neurovascular changes. Raising the hand and wrist above the heart reduces the swelling from surgery, and this is often done for several days. A patient with a fractured fibula is receiving skeletal traction and has skeletal pins in place. What would the nurse instruct the assistive personnel to report immediately? 1. The patient wants to change position in bed. 2. There is a small amount of clear fluid at the pin sites. 3. The traction weights are resting on the floor. 4. The patient reports pain and muscle spasm. The correct answer is 3. The traction weights are resting on the floor. Rationale. When the weights are resting on the floor, they are not exerting pulling force to provide reduction and alignment or to prevent muscle spasm. The weights should always hang freely. Attending the weights may reduce the patient's pain and spasms. With skeletal pins, a small amount of clear fluid drainage is expected. It is important to inspect the traction system after a patient changes position because position changes may alter the traction. The nurse is preparing a patient who had carpal tunnel release surgery for discharge. Which information is important to provide for this patient? 1. The surgical procedure is a cure for carpal tunnel syndrome. 2. Do not lift any heavy objects. 3. Frequent doses of pain medication will no longer be necessary. 4. The healthcare provider should be notified immediately if there is any pain or discomfort. The correct answer is 2. Do not lift any heavy objects. Rationale: hand movements, including heavy lifting, may be restricted for 4 to 6 weeks after surgery. Patients experience discomfort for weeks to months after surgery. The surgery is not always a cure. In some cases, CTS may recur months to years after surgery. After the nurse receives the change of shift report, which patient should be assessed first? 1. A 42-year-old patient with carpal tunnel syndrome who reports pain. 2. A 64-year-old patient with osteoporosis awaiting discharge. 3. A 28-year-old patient with a fracture who reports that the cast is tight. 4. A 56-year-old patient with a left leg amputation who reports phantom pain. The correct answer is 3. A 28-year-old patient with a fracture who reports that the cast is tight. Rationale: the patient with a tight cast is at risk for circulation impairment and peripheral nerve damage. Although all of the other patient's concerns are important, and the nurse will want to see them as soon as possible, none of their complaints is urgent. The patient with the tight cast may have risk for injury to a limb, which is more urgent. The nurse is providing care for a patient with a rotator cuff tear. What treatment does the nurse expect the healthcare provider will prescribe first for this patient? 1. Arthroscopic repair of the rotator cuff tear. 2. Elimination of movements in the affected shoulder. 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. 4. Pendulum exercises that start slow and progress over 2 weeks. The correct answer is 3. Conservative therapies, such as nonsteroidal anti-inflammatory drugs and physical therapy. Rationale: for the patient with a torn rotator cuff, the HCP usually treats the patient conservatively with NSAIDs, intermittent steroid injections, physical therapy, and activity limitations while the tear heals. Physical therapy treatments may include ultrasound, electrical stimulation, ice, and heat.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.